the exclusion of the fathers is really at the expense of mothers and families ultimately. All of my research is truly grounded in community-based participatory research approaches, and this means really listening to what the community wants. I pursued working with the RMS cluster because working with women, and particularly mothers, really led me to fathers. So there was, consistent feedback in the community saying, okay, we're doing great work around trauma and violence-informed physical activity for mothers, but there's nothing there for the fathers. My work with the RMS cluster has really, brought to the forefront that masculinities lens that I was really missing in doing work with families and with diverse communities. We often see physical activity being leveraged to bring, men together, to bring, fathers together, and that being sort of the point of commonality that works for that group. We thought, let's bring them together with physical activity, and then we can talk about fathering. But what was really important was the idea that these fathers really, or men really wanted to identify as fathers, and that was the piece that ultimately, kind of brought them together in the communities. In terms of working with those fathers, again, we had no idea what one of the service providers, calls the work of poverty, and people had referred to it as urban hunting, which was essentially, these fathers are walking all over their communities to access foods. They have to, to go get their lunches, to try and access services. And they're sort of consistently, facing barriers in doing that. And that sort of prompted us to dive into the practices and policies that are guiding a lot of the services that folks are providing. And again, sort of identifying that fathers are missing, from those guidelines, from the mandates that these organizations are following, which again, the exclusion of the fathers is really at the expense of mothers and families ultimately. There's a huge number of needs with the fathers that I work with in the Downtown Eastside context. Most of the fathers that we've worked with over the years are precariously housed. And in a lot of cases, housing is really prioritized, which I fully support for mothers and children. But often, again, sort of putting families in this challenging position where mothers and children may be housed. But if there's a father involved in that situation, they oftentimes can't live in that emergency housing. So I think housing, I would say, is a number one issue. I think lack of access to fathering supports has been huge. There's a big gap for fathers there. I think what we saw a lot of was that fathers were very eager and wanted to access services and resources that would support them in being better fathers, and they just couldn't find what they needed. Equity really has to be central to what we're doing. And there's a lot of discussions between equality and equity. And I think when we're looking at equality, it's giving, everyone the same things and saying, okay, carry on. And equity is really ensuring that people are receiving what they need. So, even in the work that we've done, we see that, with leisure access passes, for example, in Vancouver, which are passes that allow people to access recreation. And oftentimes this is at a reduced rate for community members. But in talking to participants, even the reduced rate to go for a swim, which might be, $1.60, is still too much for that individual. And they then have to make the choice whether to, save that money so their child can have a snack at school or, spend it to take part in some sort of recreation program.